Hello everyone. Today we'll be covering one of our old topics, that is neuroanatomy of cranial nerve 10, 11, 12 and 8th, that is vagus, accessory, hypoglossal or vestibulocochlear, also known as auditory. Also known as auditory. So we will be covering about these cranial nerves today. Before we go on to these cranial nerves, I would really like to introduce a term, a very small term which is based upon our old basic concept, that is compound nucleus. Before I go on to describe what is compound nucleus, we should know what is exactly the nucleus. So if you remember from our previous knowledge, a nucleus is nothing but a bunch of or collection of cytons, that is cell body of neurons in central nervous system, that is brain and spinal cord. So that is known as a nucleus. What exactly is a compound nucleus? So the compound nucleus terms means any nucleus which has more than one cranial nerve component. More than one cranial nerve component. Now some examples. There are two prime examples of your compound nucleus, that is NTS and NA. NTS stands for nucleus of tractus solitarius. Nucleus of tractus solitarius. Three cranial nerves are associated with it. It can be easily remembered by 9TS. NTS itself is a mnemonic also for the three cranial nerves if you want to remember it as. That is 9, 10 and 7. And what is nucleus of tractus solitarius responsible for? It is responsible for taste. It is responsible for taste, whereas Na stands for nucleus ambiguous. Nucleus ambiguous. Which all cranial nerves are associated with it? Again, three cranial nerves, that is 9, again 10 and 11. 9, 10, 7, 9, 10, 11. These are the three cranial nerve compound nucleuses which I would really like you to know before we start on with our lecture about 10th, 11th cranial nerves. I hope the concept of compound nucleus is clear and the two prime example of compound nucleus are also clear. So now we'll start off with our lecture, that is 10th, 11th and 12th cranial nerve. So for the sake of ease of description and ease of understanding, I'm going to be starting off with 10th and 11th together. We'll be starting off with 10th and 11th together because they have a very closely associated function together. So moving on. Now if you must notice one thing, that over here I have written accessory, but the more popular name of 11th cranial nerve is spinal accessory. Then where has the spinal part gone? So basically accessory nerve has two roots. For example, if you remember in trigeminal lecture we are told about sensory root, motor root. Somehow similar, accessory has root but it is not sensory or motor. It is, there are two roots of accessory nerve, that is cranial root and then the famous name spinal root, right? Now from our previous knowledge, again if you want what I am referring to again and again about the previous knowledge, I would really like you to guys to check out the previous lectures which will describe about many things in very simple, easily understandable concepts. Now from our previous knowledge we know that cranial nerves follow an equitable origin distribution in the midbrain. 3, 4 in the midbrain, 5, 6, 7, 8 pons, 9, 10, 11, 12 from medulla. So since we are discussing about 10, 11 and 12, so we know that all the three nerves are going to be originating from medulla. So we are going to draw a medulla over here. This is your medulla. And this is your spinal cord which is going down. The lower part of medulla extends a little bit beyond your foramen magnum. So we know. So this is your medulla. Then there is something known as nucleus ambiguous, which we have just seen. We know nucleus ambiguous gives origin to three cranial nerves, that is 9, 10 and 11. So out of nucleus ambiguous, our two cranial nerves will originate. One is your 10, another is your 11. I'll draw it with another pen so that it becomes easy. So there is your 9, there is your 10 and 11th cranial nerve, and this is the cranial root. This is the cranial root of the 11th cranial nerve. This is the cranial root of the 11th cranial nerve. So you people must be wondering, what about the spinal root? So spinal root comes from C1 to C5 spinal nerves. C1 to C5 spinal nerves, they give off branches C2, C3, C4, C5, and these branches go up from foramen magnum into the skull, and then they travel along with their cranial counterpart, and then they travel along with the cranial counterpart. So this is your spinal root. I am drawing with the help of three different pens because it will be very easily to differentiate between the new root which is carrying out which function. Now over here we'll draw another foramen. This is magnum. This is jugular foramen. Now from our knowledge we know that 9, 10 and 11, these three cranial nerves exit the skull through jugular foramen. These three cranial nerves exit the skull through jugular foramen. So this is also one of the Viva Voce questions. What all structures are passing through jugular foramen? Now you know what all structures are passing through jugular foramen. There are two more structures which pass through jugular foramen. One is inferior petrosal sinus, and another is your sigmoid sinus. Anyways, so we are not going into the cavernous venous sinuses or the dural venous sinuses as of now. We are talking about cranial nerve, so we'll strictly adhere to that. So here we are. Now your 10th cranial nerve comes and then exits through the jugular foramen. Now your cranial root of the spinal accessory follows a very weird kind of a path. So when it exits the medulla, it carries on along with 10th. But when it is about to exit the jugular foramen, what it does is it leaves 10th cranial nerve and joins 11th to exit, and joins 11th to exit. And once it exits through the jugular, it again comes back to 10th cranial nerve. It again comes back to 10th cranial nerve. So there is this very weird kind of path with your cranial root of the spinal accessory or cranial root of the accessory nerve follows. So cranial root of the 11th cranial nerve follows a very weird path. It exits the medulla along with 10th. Before exiting through jugular, it goes towards the spinal root. It accompanies spinal root, and when it comes out, it again joins the 10th cranial nerve. It again joins the 10th cranial nerve. And together they form a structure which is known as vago accessory complex. Vago accessory complex. So here we have seen the origin of the spinal accessory nerve, cranial accessory nerve, that is the spinal root, and cranial root of the accessory nerve or 11th cranial nerve. Origin of the 10th cranial nerve. 10th nerve is not doing a lot, that is vagus. It is not doing a lot of activity as such, but we see even the spinal root is not doing a lot of activity, but we saw that your cranial root of the accessory nerve is doing a lot of here and there. but then it forms a vago-accessory complex along with vagus. So some of the questions over here are, what are the components of the vago-accessory complex? It's vagus and the cranial root. So we should now go on to what does spinal root does. So spinal root, again, you know that it originates from C1 to C5 spinal nerves. It goes inside and then comes outside. It goes inside through foramen magnum. It comes outside through jugular foramen. Now what does it do? It goes on to supply two major muscles of your neck. Two major muscles of your neck, that is SCM and something known as traps. SCM stands for sternocleidomastoid and trap stands for trapezius. And what is this supply? This is a motor supply. This is a motor supply. So the motor supply to sternocleidomastoid and trapezius is coming from the spinal root of the accessory nerve, which is originating from C1 to C5. So there are two kind of questions that can be formed over here. First is, if there is a damage to magnum or jugular, which all muscles will be damaged? So your answer will be SCM and traps, but there is a catch over here. If it's jugular foramen, there will be many more muscles being damaged. But if it is foramen magnum, now you know in foramen magnum why your neck muscles might be affected, because of this reason and this reason only, that spinal root originates and comes inside and then goes outside. Anyways, so since we have seen your since we have seen your spinal root, now we will come back to your 10th and your cranial root. What do they do? So these structures, first they go and they supply something known as palate and pharynx. Palate and pharynx. Palate and pharynx. And once again, this is motor supply. This is motor supply. The predominantly motor component is from the 11th cranial nerve. So palate and pharynx motor supply comes from vago-accessory complex. Palate muscles are palatopharyngeus, palatoglossus, and many more. There is one crazy exception over here, if you remember, something known as TVP, that is tensor villi palatini, which is being supplied by fifth cranial nerve. If you remember, we talked about this in our video of trigeminal nerve, where we have decided that nerve to medial pterygoid originated as soon as mandibular nerve exits through foramen ovale. It comes out of foramen ovale and it gives off a branch known as nerve to medial pterygoid, and nerve to medial pterygoid gives supply to medial pterygoid, tensor tympani, and tensor villi palatini. So one of the palatal muscles, that is tensor villi palatini, has a motor supply from fifth cranial nerve. Rest all the palatal muscles motor supply will come from vago accessory complex inevitably. Next is pharyngeal muscles, that is superior constrictor. That are the constrictors muscle we have talked about: superior, middle, inferior constrictor. These are the horizontal muscles. There are vertical muscle also, salpingopharyngeus and every other muscle. We are not going into that as of now. This is just a brief overview we are talking about. So pharyngeal muscles are salpingopharyngeus, palatopharyngeus. Palatopharyngeus is an exception again, if you know palatopharyngeus is being supplied over here only. Then salpingopharyngeus, salpingopharyngeus. Right. So these are the supply. Now over here, 11th cranial nerve's job is done. But then again, 10th cranial nerve will continue. Your 10th cranial nerve continues and it gives off a very key branch. This branch is known as superior laryngeal nerve. Superior laryngeal nerve, which gives off two branches: internal laryngeal and external laryngeal. Internal and external laryngeal. Now what do these muscles do? What do these muscles do? So we will see. There is your bone named as hyoid. Then you have a structure known as thyroid cartilage, and then there is another structure known as cricoid cartilage. Cricoid cartilage. So what is the relation of hyoid, thyroid and cricoid to these two nerves? So basically there is a structure. So there is a structure that lies between hyoid bone and thyroid cartilage, and this structure is known as thyrohyoid membrane. Thyrohyoid membrane. And your internal laryngeal nerve supplies this thyrohyoid membrane. So what about the external laryngeal then? Once again, there is a structure that is present between thyroid and cricoid cartilage. Thyroid and cricoid cartilage. Let's draw this with the red pen because this is a muscle. Since this is a muscle, we are drawing it with this pen. And this muscle is known as cricothyroid muscle. Cricothyroid muscle. And this cricothyroid muscle is being supplied by external laryngeal nerve. This cricothyroid muscle is being supplied by external laryngeal. So what did we see first of all? We saw that there was a vagoaccessory complex. Vagoaccessory complex supplies the palate pharynx motor supply muscle, palate pharynx muscles. It was a motor supply. What all muscles are there? We saw. Then we saw that vagus is continuing its journey down and gives off a branch known as superior laryngeal. Superior laryngeal divides into internal and external laryngeal. Internal laryngeal supplies a structure present between hyoid bone and thyroid cartilage. That structure is known as thyrohyoid membrane. Then external laryngeal goes even further inferior and it supplies a structure present between thyroid and cricoid cartilage, and this structure is a muscle which is known as cricothyroid muscle, and it supplies this cricothyroid muscle, which is a very important question also. Why it is a very important question, I will let you know, but before that we will continue. So again your vagus again continues, and one of its vagus's branches, it follows a very weird path. Because there is a structure over here after which it comes up. And so because of this structure, that is arch of aorta, that is arch of aorta. Because of arch of aorta, during embryology what happens is heart is at a much superior level and it goes down. So this nerve, because of the embryological development and because of arch of aorta descending down, this nerve also descends down, but its original supply is near the level of cricoid. So it has to follow a very returning kind of a path. Very returning kind of a path. And because of this returning or coming back kind of path, this nerve is also known as recurrent laryngeal nerve. Recurrent laryngeal nerve. And what does recurrent laryngeal nerve supplies? All the muscle, all the muscles of larynx. All the muscles of larynx are supplied by recurrent laryngeal. Only exception is cricothyroid muscle. The only exception is cricothyroid muscle. That's it. But does vagus carries on some other functions also? It gives off a branch again to carotid, sinus and body, which are baro and chemoreceptors respectively, and then it goes up to your GIT. One more thing, if you my people might remember that 10th cranial nerve has also a component of the parasympathetic nervous system. So it will carry out those parasympathetic functions as well. So here we have seen your cranial nerve 10th and 11th carrying out their respective functions in detail. I hope I have covered everything which is there in this 10th and 11th cranial nerve. Now we will be moving forward to one of the important cranial nerve structures that is a very important part of your neck dissections also. That is why it is very important to cover. This is your 10th and 11th cranial nerve. If anyone wants to take a photo, they can take a photo also. And it will be very easy for you to understand if you draw the diagram yourself, because then you will be able to remember how did I teach it and what did I tell you about, along with it. which will be very important and easy to remember at the time of exam or whatever concept you're forming. This PS stands for parasympathetic. Now we'll move to 12th cranial nerve. We'll move to 12th cranial nerve. 12th cranial nerve is also known as hypoglossal nerve. It is also known as hypoglossal nerve. Now we'll start with hypoglossal nerve. Again, if you remember that from our knowledge what it is concerned, that it will be originating from medulla. It will be originating from medulla. So there is your hypoglossal. What does hypoglossal do? Now hypoglossal is responsible for the motor supply of all the muscles of your tongue. Motor supply of all the, not the sensory, motor supply. I will make a short video about tongue's nerve supply especially to clarify what all doubts are there. But as of now, we should remember 12th is responsible for motor supply of tongue. Motor supply of tongue, right? So this nerve originates. It goes outside the skull through a structure known as hypoglossal canal. It comes out the skull. It goes to tongue and it supplies it. Very simple, right? But there is a catch. Now you must be asking what catch is there. The catch is it's not alone. There is another structure C1, C2, C3. Now if you remember C1, C2, C3, C4, C5, these nerves were giving rise to the spinal root of the accessory nerve. But these three spinal nerves not only gives rise to spinal root, but C1 to C3, they also form a very important structure in neck which is very closely associated with your hypoglossal nerve. Now what is this structure? One of the C1 nerves, it travels along with your hypoglossal nerve, and just before it enters into tongue, it drops down. It drops down and gives off a branch over here. Then C2, C3, what do they do is they also form a nerve which immediately goes down. So C2, C3 from their point of origin and C1 at the point of entry into tongue, they go inferiorly and form an arch-like structure. They form an arch-like structure in the neck. And this arch-like structure is very important structure known as ansa cervicalis. Ansa cervicalis. Now you must be thinking, what is the job of this ansa? So this ansa supplies a very important muscle group, and this muscle group is known as strap muscle, ribbon muscle, or the more appropriate name, infrahyoid muscle group. Infrahyoid muscle group. Now out of these, this I told you that C1 root at the point of origin drops down and gives off a branch. But is it the only part? The answer is no. Now ANSA, you saw that C2, C3 has a different origin, C1 has a different origin. Now C1 origin has a synonym or has also a different name that is known as superior root of ANSA. Superior root of ANSA, or also known as descendants hypoglossi. Descendants hypoglossi. Whereas C2, C3 root is also known as inferior root of ANSA or descendants cervicalis. Now ANSA as a whole supplies your strap muscle, ribbon or infrahyoid muscle group. There is one exception which only superior root supplies. Inferior root has no contribution in it, and that muscle is known as thyrohyoid muscle. Thyrohyoid muscle. There is one more muscle it supplies, that is known as geniohyoid, but geniohyoid is not a part of your strap muscles. Thyrohyoid muscle is a part. Thyrohyoid muscle is a part of your strap muscles, whereas geniohyoid is not a part. So thyrohyoid is being supplied exclusively by superior root. Is being supplied exclusively by superior root. So what all muscles are being supplied by ANSA as a whole? The answer can be remembered as from a very easy mnemonic, that is host. Now what does host stands for? First is it OH, that is omohyoid. Then it is SH, that is sternohyoid. Then again it is TH, that is thyrohyoid. But from our knowledge, thyrohyoid is already being supplied by superior root, so it is excluded out. And the last is sternothyroid. Sternothyroid. So 1, 2, 3. Your three muscles are being supplied as a whole by ansa cervicalis. Ansa cervicalis, which has two roots, superior root, inferior root. Superior root exclusively supplies your thyroid, whereas both of them together supply these three muscles, that is omohyoid, sternothyroid, and sternohyoid. I hope this is clear, because ANSA is a very important structure when I'll teach neck dissection, and it will for sure come in neck dissection. So here is a common photo that I would like you people to take, so that it will be very easy for you to remember 12th and the 11th and 10th cranial nerve. Now I'll give a very brief overview about your last 8th cranial nerve. 8th cranial nerve is not very important for all of us, because it generally comes in ear reconstruction and all. We don't go that deep into the ear for surgeries and all. But still, for the sake of completion, I will cover a brief overview of that as well. So this is the last thing, that is 8th cranial nerve, also known as auditory or vestibulocochlear Now I will do this in the form of a flow chart. So I hope that this becomes very clear. Now we can learn this with the mnemonic known as spiral, CT, slim, 41, 42. You can remember the entire auditory nerve tract or course with the help of this mnemonic. So what do we mean by that? We mean that you have a spiral organ, that is the also known as the organ of Corti. Your nerve goes up, it goes into something known as cochlear nucleus, then it again goes up, then it goes into a structure which is formed due to decussation of fibers. Just make it thick. This structure looks trapezoid in nature, so it is also known as trapezoid body, but it is essentially a decussation of fibers. Now from trapezoid body, you go on to a structure known as superior olivary complex, which is also a very important structure, that is center for stapedial reflex. Now, if you people must have seen my old video of facial nerve, I told something that within the middle ear, your facial nerve gives off a branch which goes on to supply the stapedius muscle, and stapedius muscle is responsible for dampening of the sounds that come to your ear, so that your bones don't get harmed. Now, this dampening is due to a reflex known as stapedial reflex, and superior olivary complex is responsible for this being the center of the stapedial reflex. From stapedial reflex, the fibers, there are a group of fibers, special group of fibers which go up, and these fibers are known as lateral lemniscus. Lateral lemniscus. Lateral lemniscus. These are a special group of condensed fibers which go from superior olivary nucleus even higher or even more superior into the brain, and they go on to a structure, a structure known as this is known as inferior colliculus. Inferior colliculus. From inferior colliculus, the structure goes even further. So we have seen spiral, we have seen C, that is cochlear, T, that is trapezoid body, S, that is superior olivary complex, L, that is lateral lemniscus, I, that is inferior colliculus. Now we on to the M part of the mnemonic, that is medial geniculate body. That is medial geniculate body. And now in the cortex, in the cerebral cortex, they relay onto a very important area, that is area number 41 and 42, which is the primary auditory area of your human body. Primary auditory area of the human body. And this is your entire tract, or a brief overview of the 8th cranial nerve, and hence I'm going to conclude this video about the neuroanatomy of 10th, 11th and 12th along with your 8th cranial nerve. I hope those who have not taken a photo can take a photo of this, can see the mnemonic also as well on the screen. Now our next video is going to be one of the JC videos, that will be, as I've discussed already, about a potential complication of dexamethasone injection, that is hiccups, and a few more complications we are going to be discussing, but mainly our focus will be on hiccups in